Garcia, one of the sports, shoulder, and cartilage surgeons here. Today you're going to see an interesting video testimonial. This is a patient that had a lot of anterior knee pain, but also was found to have a cartilage defect on the inside of his knee. And the patient was over 50 years old. So it comes a challenging problem, really not the right candidate for a knee replacement, but also not the right candidate for certain aspects of cartilage. So we actually did sort of a hybrid approach. And what we did was a patellofemoral replacement, which means we replaced the kneecap and the groove. So he still has a relatively natural feeling knee. And then there was still a hole in his cartilage, but the rest of his knee looked perfect. So we ended up doing a cartilage transplant of the inside of his knee, kind of a unique combination that's rarely seen. But you can see the patient is very active. He did well, and hope you enjoyed the testimonial. Thanks.
I noticed that when I was, trying to do things, especially running, it would feel fine, but then it started to feel bad, and it was limiting me, which I really like to run, and so I was just getting depressed, really. And then I came in and I talked to Dr. Garcia. So what was happening was it just felt achy, a lot more achy and painful than it did before. It always sort of hurt, but it was painful, and especially when I went downstairs. I'd wake up in the morning, my bedroom's upstairs, I'd wake up and I'd walk downstairs, and I was like, ow, that is really something different, something I haven't felt before, and it was painful, and it felt limiting, really. And I couldn't run anymore. I had to stay off of it for 5 weeks, and that was more of an annoyance than anything else, because having to get around on crutches and not having your hands is bad. But after that, it started to actually go really well. I was able to walk. Garcia's like, start using that thing, and I did. Started walking more. I wasn't supposed to dance for 4 months. I started dancing after 3 months because it felt fine, really. And then within 6 months, I was running a little bit here and there, and I've been running probably 10 miles a week since then, which is amazing to me. I didn't think I would ever be able to do that. Yeah, and the surgery itself, it's sort of a joke, but it felt like a spa, really. I came in, I was treated very well. Early in the morning, the anesthesiologist came and talked to me, the nurse came and talked to me, and then Garcia came and talked to me, you talked to me, and it was great. Always felt like I was taken care of. Rolled into the room, put under, woke up, and it was fine after that. Absolutely. One of the things that scared me was that Dr. Garcia told me that if I let it go, it would just get worse and worse, and then I would have a full knee replacement. I was like, wow, that sounds really brutal. I'm going to live through a bunch of pain, and then I'm going to have a complete knee replacement? No. Get this done, be able to do everything that I want, and avoid that total knee replacement. It's a no-brainer, really. Said, sure, let's do the surgery. And it was great. It was probably the best decision I could have made.
Walk on by and wait on the corner.